conferences. This, of course, is a policy that the government has put in place where we have open and frank discussion, open and frank dialogue with you, the general public. For those of you who are joining us for the very first time, the format is as follows. The members of the press corps will be given the opportunity to ask their questions, and of course the Premier would respond, but prior to that the Premier will make his statement. Those of you who will be asking questions, you're kindly asked to first give your name and the agency that you represent. In so doing, we'll be able to give you any follow-up answers or any follow-up documents that you may require. Ladies and gentlemen, without further gilding the lily, join me please in welcoming to the podium the Honorable Premier of Nevis, Mark A.G. Brantley.
Good morning, members of the press, and thank you for being here yet again at this monthly press conference. I start with extending congratulations to our Independence awardees. As you are aware, we had a very brief and COVID-compliant Independence celebration at the Government House here on Nevis, and we were able at that point, the Nevis Island Administration, to recognize some outstanding divisions. In the category of education, Mrs. Althea Jones; culture and music, Mr. Oscar Astro Brown and Mr. Lee Garlic Swanston; in sports, Mr. Winston Cook; in health, Ms. Laurel Smitten; in literature, Dr. Whitman Brown, who couldn't be with us, but nevertheless we recognized him for his outstanding achievements and contribution to literature; in art, the very well known Mr. Vaughan Anslin; community service and business, Ms. Thelma Hunkins; security, Mr. Austin Lescott; and marine services, Mr. James Green. We also recognize and celebrate and congratulate those who receive national awards, and the list there comprises 5 divisions, and those divisions were Reverend James Rudolph Smitten for religious services. He received the Star of Merit. Mrs. Shirley Gloria Estelle Brown for education. She too received the Star of Merit. Dr. A. Linton Liebert for medicine. He received the Medal of Honor. Mr. Brian Dyer for national service in a crisis. He received the Medal of Honor. And Dr. Judy Nisbet for national service in a crisis. She too received the Medal of Honor. And so we congratulate them all. I also would like to extend the congratulations to the new leader of the Nevis Reformation Party, a political party of long standing here on the island of Nevis, Dr. Janice Daniel Hodge. We are advised was elected at the NRP conference, and we would extend the best wishes to her and wish her all the best in this new undertaking. The Ministry of Agriculture will observe World Food Day 2020 with a series of activities during the week of October 16th, and the theme is Grow, Nourish, Sustain Together. The week, October 12 to 17, will feature the presentation of dishes containing local items such as breadfruit, banana, sweet potato, and other ground provisions, farmers' markets, and food demonstrations, as well as a food fair. Now, this is the headline. I try to give you a headline every week. The highlight of the week is a minister's cook-off featuring the Premier versus Minister Jeffers. If you are amused and bemused by that, you should understand I read it for the first time this morning. So our cooking skills are going to be put to the test, Deputy Premier versus Premier. I'm not so sure that's going to work, but that appears to be the highlight they're telling me of that week of activities for agriculture. If we can turn quickly to education, I think all of us would be aware that our schools reopened. All of the schools in Nevis and preschools are now reopened. The Ministry of Education is certainly pleased to have incorporated in its service to students who travel on our school buses. We now have 6 school bus attendants. And what the attendants do is sanitize the buses and ensure that we have the protocols that we've established for COVID, that they're being taken seriously. Phase 2 of the Charleston Preschool opened on September 7th with a roll of 27 students. The early childhood unit is fully staffed and functioning well. The Charleston Preschool Phase 2 came into being as a result of the need to adhere to the COVID-19 regulations as they relate to physical distancing. Because of the physical distancing protocol, the Charlestown preschool could no longer accommodate all of the students who would normally attend, therefore the need for additional space. The Charlestown preschool phase 2 is located in Farms Estate. Let me take some time to congratulate Mr. and Mrs. Vincent Perkins. They donated 2,000 bottles of hand sanitizers to students of our government schools. The bottles came with clip-on rings that can be clipped to their backpacks and belt straps, where they can be easily accessed to sanitize their hands as often as necessary. The Ministry of Education, by extension the Nevis Island Administration, would like to thank Mr. and Mrs. Perkins for their timely and generous donation. Let me at this point, members of the press, take a moment to express to the Lupinacci family the sincere condolences of the government and the Office of the Premier on the passing of Maureen Lupinacci. Those who are familiar with the Lupinacci name would know that Mr. and Mrs. Lupinacci were pioneers in the hotel industry here on the island of Nevis. They would have worked at Zetland's when it existed, and they have since bought and have been at the Hermitage Hotel for many, many years. Mrs. Lupinacci, Maureen Lupinacci, was ailing for some time, and we were advised that she succumbed yesterday to her illnesses and therefore has gone to the great beyond to be with the ancestors. We would wish her family all the very best, and as I like to say, I would wish them to know that the prayers of the multitude shall comfort them in their hour of bereavement. And so we express our sincere condolences to the Lupinacci family on the loss of Maureen Lupinacci. We have also, of course, learned over the past few days of 2 new coronavirus cases on Nevis. I believe that up to 2 or 3 days ago, when we had this news, the island was performing extremely well and was doing better than most. But I've always said that we had to prepare our people for the inevitable, that COVID cases may well come, and I suspect will continue to come. I am pleased, however, that our systems worked, that these cases were detected immediately, and that these individuals have been quarantined and isolated, and at this point our health officials are saying that they're doing well and that there doesn't appear to be any community spread. These 2 cases were imported. These are individuals who came into the island, and so these are not an example of any local transmission, but rather people who had come in. We would want to use this platform to express best wishes to those who have been diagnosed for speedy recovery, and we pray and hope that we can continue to be vigilant. What these 2 new cases reminds us of, however, is our need to continue to be sensible and to continue to be vigilant. We have heard that there are no cases. We have seen the clamor, and I get inordinate pressure from the public who says we want to get back to normal, we want to do everything as usual. People reluctant to wear their masks, they think that these things are unnecessary. But these 2 new cases remind us that in fact COVID is still with us, it still will continue to be with us, and as a consequence we have to continue to be careful. And so whilst there doesn't appear to be any particular danger from these 2 new cases, the fact that we have recorded new cases is a reminder to all of us, a stark reminder, that we have to continue to be sensible and adhere to the various protocols as set by our health authorities. And so I certainly would invite any questions the press would have on that when we get to that stage, but I just wanted to be clear that our systems have worked and continue to work because we were able to detect, isolate, and if necessary, we will be able to treat. Fortunately, the 6 cases that we've had on Nevis to date, none have required hospitalization for COVID. None have required any treatment for COVID. All have recovered. And let me go back, I'm sorry. The 4 that we had initially have recovered. These 2 now certainly would be within the period of time, which would normally be 14 days. So we are hopeful that they too will recover fully and recover speedily. As part and parcel of our ongoing efforts at a more open and transparent government, and I'm very proud of our record to date, This government I have been privileged to lead was the entity that operationalized integrity in public life. As Premier of Nevis, I and my cabinet created history by being the first ones to actually file our declaration of assets with the Integrity Commission. We have been very committed to that process. We have passed freedom of information legislation in the Nevis Island Assembly, and whilst that legislation has not yet been operationalized, we have every intention to do so. We have instituted this monthly press conference, again an innovation whose time had come, where members of the press can come and ask questions. We, of course, continue to engage at regular intervals with members of the public whom we serve. One of those developments has also been now a meeting that I was able to convene on the 4th of September with the parliamentary opposition in Nevis, the Honourable Cleone Stapleton Simmons, representing the Nevis Reformation Party. I would want to go on record to thank the Honourable Cleone Stapleton Simmons for a very frank exchange of views. I was able to update her on our COVID-19 response, reopening of our schools, the financial state of the island at this time, and a range of other issues that she raised with me. I would wish to go on record to thank her for her dialogue and to commit to regular meetings of this nature. I think that we must get to a point where all ideas in our country contend, and the ruling party and the ruling government doesn't necessarily have a monopoly on ideas. And so I'm prepared to listen, and for those who are prepared to speak, we are prepared to have that dialogue. And I certainly would want to thank the Honourable Cleone Stapleton Simmons for that fresh breeze that she has brought to the approach for interaction. And so I'm very, very grateful for that and for that opportunity to engage with her, as indeed we have done. If I can switch quickly to the Ministry of Culture, Youth, Sports Development, Telecommunications and Information. Under its Restore, Inspire, Secure, Empower, RISE Families Program, as we know you've heard of that acronym RISE, the Social Services Department has hosted a disaster preparedness session for parents, and we did that in August. The session saw full attendance focused on family preparedness for hurricanes and various other disasters. Parents are mandated to receive this training and have prepared disaster kits and family disaster communication plans as a condition of the program. RISE is a 2-year conditional cash assistance and empowerment program for families on Nevis. And all that RISE is trying to do is to get families that we think are at risk. We provide assistance for them financially, but the assistance isn't just provided. There's counseling, there's assistance that's provided, along with the assistance to seek to bring these families into what I might call the norms of expected behavior. And so this RISE program has been going, and certainly I would want to continue to encourage those at the Ministry of Culture, Youth, Sports, Community Development as they continue to offer this type of development for our community here on the island of Nevis. Let me take the opportunity as well to congratulate our Special Olympian Robert Liddy. Mr. Liddy recently participated in the virtual Swim Miami 2020 competition. He placed first in the Special Olympics category and 14th overall. Robert's winning award was presented to him on Tuesday, September 15th by Minister of Sport, the Honourable Eric Evelyn. Special mention must be made of his coach, Mr. Winston Crook, as well as Terry Andrews, who facilitated the participation in the competition. Robert was one of the Federation's Special Olympians who performed creditably at the World Games in Abu Dhabi last year. Congratulations certainly to young Robert Liddy for his outstanding performance in the Miami Swim Contest. Another headline, perhaps, members of the press, that as swimming continues to receive much attention from the Ministry and Department of Sports, as well as private organizations, I am proud to announce that a 25-meter in-water pool was commissioned at Wally on Thursday, September 17, 2020. The initiative was spearheaded by President of the St. Kitts Nevis Swim Federation, Mr. Winston Crook, and sponsored by World Swimming Body FINA, F-I-N-A. The ribbon cutting to commission the pool was done by the Ministers of Sports from both St. Kitts and Nevis, the Honourable John L. Powell and the Honourable Eric Evelyn. The pool will assist in training of swimmers to be able to compete regionally and internationally. Now, I want to explain that this pool is in the ocean. It is not a freshwater pool. It is actually in the elements, in the ocean. You can see it for yourself at Wally Bay, which is a calm area where we have done this pool. It is seen as a first step. We as a government are very committed to having an Olympic-sized swimming pool done here on the island of Nevis. We think we have good momentum in relation to this initiative. But in the interim, this in-water pool, as it's called, is going to serve that purpose of trying to prepare athletes for swimming. It also serves another very useful purpose, and in light of the painful history of Nevis with the Christina disaster, this allows us an opportunity to expose more of our youngsters to swimming. It is one of the ironies of life that many of us who live on an island can't swim. So we are surrounded by water and yet we cannot swim. And some trace that to the phobia and the real anxiety that was created when we had the Christina disaster way back in 1970. I know as a boy my mother used to admonish me not to go to the sea because the sea was associated with death and destruction for so many. We also have stories of so many of our fishermen who have been lost at sea over the years. And so there has been developed that fear, and as a result, many people do not swim and cannot swim. So this initiative is not only a sporting initiative, we're also trying to change hearts and minds and attitudes towards swimming, and hopefully the young people will take advantage. And even those who are not so young. I won't point at my PS, Mr. Daniel, but he too comes from an area very close to the sea. I'm not sure of his swimming capabilities. So I would just want to encourage folks who are inclined to go out and be a part of it. Now, the Newcastle police station, I'm sure the members of the press who may have a question ready for me, so let me preempt the question. Because on the last occasion I did promise that we would seek to have the station opened for independence. I am advised this morning that all the major works are completed on the structure. The delay, it appears, has to do with the perimeter fencing that we have not yet been able to complete, and we did not want to open the structure, that is the building, without the perimeter fencing and parking being completed. So we have mobilized the little resources that we could have found to get that done, and we are hopeful that we will have a further update to the public shortly. I would hope that before the next press conference we can say something publicly, but in any event, that is the reason why we have not opened it. We are also, of course, engaging with the federal government in terms of outfitting the station once it is ready. I believe that you would know that that station has been funded principally through a loan secured by the Nevis Island Administration from First Caribbean, and we have had an injection thus far of 1 million EC dollars from the federal government as a contribution to that effort that you see there in Newcastle. I think that individuals will admit that it is a very imposing and significant edifice. It will host not only the police but also the fire services in that area, and we believe that it will provide much better facilities and amenities for those hard-working members of the fire and the police services. So I would want to apologize before I'm excoriated in the press for giving you a date that did not materialize. I would want to apologize, but to tell you that the work is ongoing and that the major works are done. It is only now the perimeter fencing and parking to be completed, and of course we await the outfitting, the furnishing of those premises as discussed with the federal government. The Ministry of Communications and Works, a number of management changes have taken place within the ministry. I'm sure members of the press, you would have heard them already, but I will publicly announce them, that these changes are going to be effective, or were effective, from 1st September. These changes are really intended to improve efficiency and the overall management of the ministry, and we hope will assist in better coordination of activities, projects, and programs. Mr. Jevon Williams, he's now employed as the Director of Public Works in the Nevis Public Works Department. Mr. Diora Pemberton is appointed as Director of the Department of Physical Planning and the Environment. Mr. Joel Williams has been appointed as GIS, Geographical Information Systems Manager within the Project Management Unit within the Ministry of Communications. Miss Tanya Bartlett. She has been employed as manager of the Nevis Water Department. She is the first female appointed in that role, and we are very pleased and proud that she has been able to ascend to that role. She is not only female, but she's also young. And that is a commitment that we continue to make to young people to seek to elevate them. And so we congratulate Ms. Tanya Bartlett. Mr. Roger Hanley at the Water Department, he's been appointed as Operations Manager within the Nevis Water Department. We would want to congratulate all in the new roles and solicit the full support and cooperation of the various ministries and departments, and of course, the general public as well. If I can switch very quickly to the Ministry of Health and Gender Affairs. The Health Promotion Unit, I like to say one of the best units in government, they celebrated the Caribbean Wellness Week under the theme Power Through Collective Action, Stronger Together. The week ran from 7th September to 12th September, and it promoted a number of online activities and included the annual Sneaker Day, Health Promotion Unit and ULive workout sessions, and the establishment of health stations. The week culminated with a wellness walk on the 12th Caribbean Wellness Day, a day that is celebrated by CARICOM countries as part of a unified response to promote health and prevent and control the epidemic of NCDs or non-communicable diseases. The Ministry of Health, I'm also pleased to announce, received a very generous donation of 100,000 disposable face masks from the Medical University of the Americas. This was handed over on the 8th of September. During the presentation, Dr. Ralph Crum, Associate Dean of the institution, indicated that this was MUA's way of assisting the people of Nevis in the fight against COVID-19. The ministry has since handed over some 12,500 of these masks to the Ministry of Education. And I believe that I had spoken about that previously, that the purpose here is that we want to have stocks of masks available at our schools so that in the event that a student might forget his or her mask at home, or a teacher or somebody who works at the school, then the principal should have access to some masks to make available. This is not intended to be a replacement for you getting your mask. In fact, I'm very proud that this government distributed masks to every single household. These are washable and reusable masks. We were assisted by donations, and we went out, fanned out across the island, and we went to every single household. So everyone in Nevis, in terms of, let me not say everyone, every adult in Nevis was equipped with a reusable, washable mask. These masks that we're talking about now are disposable masks, and these ones are intended as a backup or support. I'm very, very proud at my government's initiative in this regard, because this is the second time that we are distributing masks in a public way. That is disposable masks. From masks that we had received from our friends, the Republic of China, Taiwan, we were able to make masks available to all of our churches. And now we're making masks available to all of our schools. In addition, of course, to what I've said, where we made washable and reusable masks available to all of our households. I do not believe that any other government in our region has tried to do what we have done here, and I believe that that is a signal achievement of which we are proud. We could not, however, have done it without the support of institutions who have contributed significantly, and in this case, the Medical University of the Americas. I would want to thank the ownership, their board, the management, staff, and all of those there who made 100,000 masks available to us and allowed us, therefore, the ability to equip our education system with available masks as a backup and as support. 2 ventilators that were purchased by funds from the Nevis Island Administration with assistance from the Taiwanese government in early March are now on island. These machines are useful in assisting patients who are unable to breathe, whether as a result of pneumonia, coronavirus, or even traumatic injury. The ventilators, we have heard a lot about them as a consequence of the response to COVID, but the truth is that ventilators have a wide application. This brings a total of 8 ventilators available on the island of Nevis for use in our ICU unit at the Alexandra Hospital. And so we started out on this particular path. I believe we only had 2 ventilators available at our hospital. We are now up to 8 and this has been a result of our continued efforts at investment. And here we have ventilators that were purchased by us with assistance from our friends, the Republic of China, Taiwan, as we seek to better equip ourselves to manage what may come in terms of COVID, and as I said, to be able to respond to patients who have pneumonia or even a traumatic injury. Lastly, as an update from Health, the Ministry of Health is thrilled to welcome Mr. Macmillan Coffey, who is a native of Dominica, to the community mental health team. He's a qualified and experienced counselor, having worked for 17 years in areas such as the psychiatric unit and social services department in Dominica and Ross University in St. Kitts. Mr. Coffey's presence will allow the mental health unit the capacity to support more clients desiring greater change in their lives. Incidentally, yesterday we would have celebrated World Alzheimer's Day, where we're trying to bring greater focus on mental health issues and dementia in particular. And so many people would have worn purple yesterday as an indication of their support of World Alzheimer's Day. And so this government continues to invest and invest significantly in mental health. We consider mental health as being critical to the overall health and well-being of the people of Nevis. Let me switch gears to tourism. As you know, tourism has been engaged together with the health authorities on Nevis and the Nevis Tourism Authority. That is the Ministry of Tourism, the Nevis Tourism Authority, and the Ministry of Health have all coordinated on providing some training as we anticipate the reopening of borders in October, and to provide training as we anticipate the reopening of our hotels and other establishments, guest houses, as the case may be. Phase 1 was completed. I have reported on that already. Phase 2 was the trainer program, and that took place over the period 14 to 18 September at the Jessop's Community Center. There were 294 participants trained over 4 days. Each tourism entity was represented by 2 to 4 employees. Tourism, and it's broken down. If the press would want that, I would get to that later if there's a need, but there were 294 participants and trained the trainer. This is in addition to the nearly 1,500 persons that were trained in terms of frontline workers, immigration, customs, etc. So this is a second wave of training. The persons trained in this train-the-trainer phase are expected to go back to their respective establishments and to train their colleagues. So we're engaging in ongoing training. We're just not doing it and say people might forget. We are saying that this has to be continually reinforced. The feedback has been very positive, and we're quite happy and would want to thank those that participated. Practical sessions included corrective donning and doffing of PPE, that's your personal protective equipment, mixing of cleaning and disinfecting solutions, cleaning of high-touch surfaces, proper hand washing techniques, vehicle cleaning techniques, and proper bed linen removal and disinfection. Some entities, I regret, chose not to participate in the training, and I am to advise them that this training is compulsory for them to operate in the COVID-19 environment, especially when the borders reopen. So let me just say that again. Some entities and individuals apparently decided that they would not participate in the training. I want to emphasize that the training was mandatory. And so if you chose not to participate, you're merely jeopardizing your business and your ability to function once borders reopen. We all are in this together, and I encourage those out there to do what is necessary and to be responsible and ensure that their entities and business places are ready for business in this new COVID environment when we reopen. The Pinnis Park update, I'm sure you have driven by and you see that there is activity at long last happening there. I am very happy that the actual construction started on August 24th. I was privileged a few days ago to tour the site with His Excellency Tom Lee, the Taiwanese ambassador to St. Kitts and Nevis, and his team, and I was accompanied by Minister Spencer Brand. We had a tour to determine what was happening there. We were told that the project now is 18% complete. That is, they're doing it in these stages where they're giving us percentages, and that the anticipated completion date is the 31st of December 2021. What is happening is that they're opting to do a lot of the project simultaneously. So, for example, they have subcontracted out things like the bathrooms, which are going to be done at the same time, the parking lots, which are going to be done at the same time. In an effort to save time, we all understand that this project is long overdue. And I have spoken about this project now, it seems, for years. Well, thankfully, the project is now happening. We again thank the Taiwanese government for their funding. You will recall that we created history here a year ago when President Tsai, President of the Republic of China and Taiwan, visited the island of Nevis. The first time ever that such a visit had occurred. And we had the ceremonial turning of the sod over a year ago. I believe that was in July of 2019. So the fact that we are now in actual construction is certainly good news for the people of Nevis. This work that has been commenced, the employment, the contractor is Kwang Jun, a company from Taiwan. The current employment, we are looking at 30 of his workers that he has brought in, Taiwanese workers, and there is an additional 24 local workers currently on site, an additional 10 are, we're told, to be hired shortly. So we should have a total of about 64 persons working on that site. I end with this last bit of information, and that is that I have not sought as Minister of Finance or as Premier of Nevis to hide the fact from the public and from the press that we are going through a very difficult period on the island financially. I think that all of you could understand, because Nevis, more so than other destinations, other countries, other jurisdictions, is heavily dependent on tourism. And our tourism plant has effectively been shut down since March of this year. And so business that we had anticipated, you would have heard me being very bullish on what we anticipated for tourism, because this was the report that we got from our main tourism stakeholders that Nevis was poised to break all records for 2020. Well, they say man plans and God unplans. And so Corona appeared out of nowhere, and the rest, as they say, is history. And so our hotel plant has been mothballed, shut down, since about March of 2020. And we have therefore lost now 6 months, March, April, May, June, July, August, September, 7 months of any activity. That has resulted in layoffs. It has resulted in tremendous trauma to our people. It has also resulted in government revenue being demonstrably down from what we are accustomed. So our revenues continue to plummet, and these months have not been easy. I can assure you that we are doing our very best to see where we can control cost, expenditure. We have committed to maintaining our workforce and ensuring that our people who work for government are paid and paid on time. We are grateful to God that we have thus far been able to maintain that commitment. But we continue to look to see what we can do to curb expenditure and to control expenditure, since revenues are simply not what we are accustomed to. And so this has forced us to look at expenditure to determine where savings can be achieved. We have already revisited some contractual arrangements to streamline the scope of regular payments from the Treasury. We have also, with immediate effect, directed that all overtime has to cease. People may well look at me and say, what are you talking about? I didn't know government had overtime. But yes, there are occasions when workers, particularly those in public works or the water department, the maintenance team at our schools, etc., would be required to work overtime. And overtime pay is something that we feel can be looked at in terms of a cutback. So we have directed that all overtime must now cease until, of course, we have an improvement in our financial condition. Third-party arrangements with trucks, heavy equipment, and other such rentals will also be looked at and be subject to review. We, of course, encourage our truck and heavy equipment operators and owners to try and be competitive in this environment in terms of their pricing. And I say that because I believe some of our businessmen and women have the attitude that a backhoe costs $150 an hour. An excavator costs $325 an hour. And whether we work for 1 hour or we work for 100 hours, it is the same price per hour. And whether it is COVID or it is not COVID, it's the same price. I am saying that it is time now for all of us to tie our bills. It is time for all of us to recognize the reality that we are dealing with in the island, that with our industry, our main industry, tourism, still closed down, that some difficult days have befallen us, and we expect that there will be more difficulty before we're able to come out on the other side. And so a word of warning, if you will, an expression from me as to the situation. This is the reality that we're dealing with, and I'm not known to hide from that reality. I'm always seeking to come to you and to bring factual information. And so the government continues to see where we can cut expenditure without compromising the service that the government renders, and certainly without compromising our workers, who are our first commitment. I believe the good people in the Ministry of Finance will say that every month that is the first question: are we able to satisfy our obligations to our workers? And once that is done, we then look at other things. But that is a commitment that we have made, and thus far, as I said, to the grace of God, we have kept. And so, as I said, some difficult days lie ahead. We continue to do all that we can to stimulate activity in the economy, whether it is through incentivizing construction, incentivizing the real estate sector, asking individuals to avail themselves of low interest loans that are available, to try and stimulate small business development through CEDU, the Small Enterprise Development Unit. We have continued to do what we can do to try and stimulate activity, but we have the reality that our main engines, like the Four Seasons, are still offline, and that has an impact on people's jobs and livelihoods, and an impact on the government's revenue. And so I want to make that very clear, that we will continue to make those efforts, but we have these exigencies that we're dealing with, and that are just the reality of this life now in Nevis with the onslaught of COVID. That is why for us the border reopening is so critical, that we will have to assess certainly and manage the risk, because it is risky. And I'm not going to stand up here and pretend that we open the borders and all will be well. There is a risk. What we need to do is to ensure that that risk does not become an unacceptable risk. And that is why we need to manage that process very carefully. But we have to weigh the risk of reopening against the risk of not reopening and continuing to see the rapid and, tremendous deterioration in terms of our financial situation on the island, in terms of the local economy, and also in terms of the government's ability to meet its commitments, and you at the household levels, your ability. And some of us are very glib about this issue of reopening. I have heard some say at the top of their voices that we should keep the borders closed as long as possible because they want to keep COVID out. The two cases that we've just announced on Nevis demonstrate that you can't keep COVID out, because these were our own people coming home and they brought it with them. So really the talk of keeping it out is perhaps unhelpful chatter. We have to now have a realistic narrative that COVID is likely to be with us, and the question has to be, can we manage and can we live with it? No different to HIV or any of these things that befuddled us. We had to develop a way to coexist. And until a vaccine comes, or until some remedy comes for COVID, let us accept that we will have COVID. And so that is the balance that we must strike now. And many who are shouting at the top of their voices and saying, keep the borders closed as long as possible, I have looked at them, and most of them have not had any impact on their income. It's very easy for you to talk when you're a government employee, you're employed to a bank, you're employed to some institution, and there's been no impact to your income. Consider for a moment your brother who's a taxi driver. your sister who works at a restaurant, your cousin who works at a hotel. They have been out of work for months. And so sometimes when we make these pronouncements and we're so passionate, I think that we ought to take stock and think and consider that we are not alone in this country, that there are others, and we need to take into account their circumstance as well. Because if I'm a taxi driver right now, I don't know how I'm paying for my bus. I've had no income since March. And yes, the government has tried, and we've done as much as we could. We've done far more than most. But the reality is that there's a limit to what we can do. And so the $1,000, for example, from Social Security, and I'm grateful that the Social Security Board has extended it for the month of September to help individuals who are going back to school and have back to school expenses. But the reality is that that could be no real substitute for an income if you were working. That was merely an assistance that was rendered. And so I think that we have in this conversation to hear those voices as well. Because when Four Seasons is going to announce to us that they had to lay off 400 plus workers, consider that in some households, both husband and wife, both breadwinners work at the same hotel, both gone home. So I think that that aspect of the conversation is as relevant as those who say keep the borders closed. Some, it appears, would want them closed permanently. We have to remember that there are other people in our community and there's real suffering out there, and I understand and I empathize and I continue to do all that I can as Premier of Nevis and Minister of Finance on the island of Nevis, and all that I can at the federal level as a member of the federal government to be that voice and to do that necessary work to provide support and comfort for our people in this very difficult period that has not been caused by us, but certainly nevertheless is a period that we have had to endure. Thank you, members of the press. I will now take any questions if you have them.
Good morning, everyone. Good morning, Mr. Premier. Jarvis Brown from Van Radio. 3 questions for you, sir. In addition to what you have mentioned with regards to the tourism workers being trained and all of that, just one question, sir, to sum up what you said. How ready are these tourism workers and even the health authorities in keeping with the reopening of the borders? Because today is September 22nd, 8 more days until October comes. Although there has not been an official date as to when the borders will reopen, we just want to know again how ready or how prepared the tourism workers, health authorities, etc. The second question is, you did mention that some persons opted not to participate with regards to, the preparation of the borders, etc. But the question is, you did say that they can't operate, but what if they operate nonetheless? So that's question number 2. And the third question is, you mentioned about the cutbacks and overtime being cut back, etc. But can you list some other measures that have been put in place in addition to the cutbacks, sir? And those are my 3 questions.
Okay, thank you very much for your questions. How ready are tourism workers? The short answer is we will see how ready we are. It is like asking me, how ready are you for a war with the United States of America? All I can say is we've never had a war with the United States of America. So we're training, we're preparing ourselves. But we'll have to wait until that war comes to determine if we're ready. We have, I think, been trying our best to be responsible as a government. We have already trained, as I indicated, about 1,500 individuals. We have now trained 294 trainers who we expect to go back and continue the training of individuals at the establishments. We are also aware that major employers like the Four Seasons have their own training protocols and programs that they've implemented. If you go to the Four Seasons now, for example, your temperature is taken at the gate. You're given a band which identifies you as a guest or as an employee. You go in, they take your name, they take all of these details from you. You have to wear a mask. All of those are new protocols that have been put in place. But it would be requiring of me that I engage in some form of soothsaying if I am to stand here today and tell you that I know what is going to happen when borders reopen. What I can say is that we've had other places, and St. Lucia is a shining example now in the region, where they've opened, and St. Lucia has been open now, I'm told, for 3 months, and they've had no difficulty. And so it suggests that it can be done if we are prepared to look at what is working elsewhere and take the good parts and apply it here. I would want to say one last thing on that, and it is something that I have said repeatedly. COVID came out of nowhere. I am not going to pretend like some and say that I knew this was going to happen, because I have said publicly that when I heard about Wuhan, I never thought in my wildest imagination that Wuhan would reach Charlestown. Wuhan is not even a major city in China. So I think that COVID really took the world by surprise in terms of the rapidity of spread and how all pervasive it has been in terms of impacting so many of us all across this globe. No country hasn't been affected. But the point that I want to make is that there is no manual. There is no book that we can read. Nobody has been able to say that this is what you do when COVID strikes, because we've never had this before. Certainly not in living memory. I think some people have referred to the Spanish flu that happened sometime around World War I. None of us in this room was around during that time. And so the truth be told, that we are in many ways adjusting as we go. So when I'm asked, are you prepared? The answer is, I'm trying to do the best I can with the knowledge that we have, the research that is available to us, and what the experts are telling us. But COVID itself has shown that it is something that is rapidly evolving, and the response has to be rapidly evolving. Today, for example, you hear that if you're a certain age as a child, you ought not to wear the mask. The mask is for children. That may change as more becomes available, because this is something new, not only for us here in St. Kitts and Nevis, but new for the region and for the world. And so I can't give you a more definitive answer than to say that we're doing the best that we can to be ready. The proof of the pudding will be in the eating. So when the borders open, we will then have to determine whether what we have done and the preparations that we have made are working. You take ventilators for example. We were told early in this pandemic that ventilators, and everybody, I will tell you that we were trying to order ventilators, because I said that as a government, wherever we found the resources, if we had to take money from other ministries to buttress what we were doing in health, bearing in mind that this was unbudgeted. Nobody anticipated COVID when we did our budget address last year in December. So all of this expenditure is unbudgeted. So you have to find, and I said, listen, we must do what we can. You know what? We could not find ventilators. Suppliers were saying that they were so in demand globally that there was a backlog. And you were being forced to wait months. You had money to pay, you know, but you could not buy because there was a backlog. Now, I hear the scientists saying the ventilators may not be as important in the fight against COVID as was originally stated. So I use that just as an example to say how this thing continues to evolve. So I might have said I'm prepared because I have 100 ventilators at our hospital. Only 3 months, 4 months later to hear why ventilators may not be the answer that we thought it was. So we have to await the reopening. All I can say is that we're doing our very best with the available information to get ready. Those who did not participate and may want to open, I anticipate that persons may try to do that, but that is why we have the compliance unit, the task force, which will have to go around and will have to inspect and will have to give a passing grade. If individuals are not prepared to be COVID compliant, then they will not be allowed to operate. And we will have to get the police and the task force to shut them down. So it is in everybody's best interest to cooperate and make sure that we are safe. Remember, in this fight, it is all about your safety and the other person's safety. You may feel that this whole thing is foolishness, so you can do what you feel, but you then endanger others. And so we are saying, for example, when we say wear a mask, and incidentally for those that are watching, I'm not wearing a mask because there's nobody close to me. I just want to make that clear. But when you say wear a mask, sometimes you get the argument, oh, why should I wear a mask? Well, it's not just for your protection, it's also for the other person's protection. And you hear me preach all the time about being your brother's keeper and your sister's helper. We definitely need to look out for each other. Cutbacks, where we have seen, as I said, this is a matter that we are looking at. I have identified the heavy equipment trucking business where we are looking to see what we can do. I've identified certain contractual commitments that the government has. We're seeking to revise a lot of those contracts. So, for example, if we have a contract where we're paying a monthly sum, a commitment, we are looking now to say, well, can we pay that in a different way so that we can have some savings potentially? We are looking at the overtime that I've mentioned to see how we can cut that as well. And we will certainly be looking at our, what we call a capital side. Some of government costs are hard costs, meaning built in. I can't, for example, at this stage, although I've seen it happen elsewhere, say to our hard-working public servants that you must take a pay cut. It would be nice if they volunteered, but that is unlikely. So the reality is that we have to deal with those areas that we feel are, if you will, discretionary, and that we feel some adjustments could be made. I would want to assure the press and members of the public that all of these measures, we hope, will be short-term measures, but they're measures designed to deal with the very harsh reality now of the tremendous downturn in government revenue as a result of COVID-19 and the closure of the economy occasioned by that. Any other questions?
Good day. Premier Brantley. I'm Lashan Dixon, St. Kitts News Observer. Following up again on the borders reopening, you say you don't know if you're ready until you're really tested, but how confident are you in the protocols that are being put in place to welcome visitors? And how would you sell the importance of the borders reopening to those who are skeptical of it? And also you said the island was dependent on tourism. With that being a fickle industry, considering what we're going through now, what are some alternative solutions the Nevis Island administration can look at going forward to drive economic activity within the island? Thank you.
Thank you very much. You asked some very important questions. How confident? I'm as confident as I can be, given all that I've said about the changing environment and the uncertainty that COVID presents. But I believe that our preparation has been in accordance with what we know at this point. And so until something changes in terms of that knowledge, and I use ventilators as an example, I think that we are fairly confident that we can manage. And as I said, we are seeing other countries doing it. St. Lucia is doing it and doing it well. And so we think that we can manage, and I'm fairly confident that we can do so. Our people have been subject to continuous training, particularly our people on the front line. So I feel fairly confident, but as I said, I can't know. I don't want a situation where something happens and people say, oh, you gave us false confidence, because I recognize that this is a fluid situation with COVID. You asked about tourism and our dependence on tourism, and we are dependent. It is not unusual, because I think the Caribbean as a whole is heavily tourism dependent. Other countries such as the Bahamas, Barbados, Jamaica, St. Lucia, and some others are even more dependent than St. Kitts and Nevis. St. Kitts and Nevis has a level of resilience because, of course, we have the Citizenship by Investment program, which has helped in terms of providing a bit of a buffer. But tourism continues to be our mainstay, and it will continue to be our mainstay for some time, because let's face it, we have a competitive advantage. The Caribbean is a place that people want to visit. It's like the Rolls-Royce of the tourism industry. When people hear the Caribbean, there's a certain romanticism that is created. People want to visit the Caribbean. There's nothing, I suppose, as lovely as being in the cold winter of London and to tell your co-workers you've just come back from your holiday at the Four Seasons or the Montpellier Nevis in the Caribbean. So there's a certain mystique about the Caribbean that I think is invaluable, and it gives us a competitive edge. It is not by chance that we see such a tremendous cruise industry in the Caribbean is because we have a competitive advantage. So tourism will continue to be relevant. How tourism is going to look post-COVID, that will be the question. Because now with the protocols and all that have to be adhered to, I think certainly you're probably going to see fewer tourists, that is less mass tourism. And I think that islands like Nevis are very well positioned because of our product, which has always been a higher end, lower impact in terms of numbers type of product. So I think those jurisdictions that are offering the villas and the type of accommodation where people can actually be on holiday but be separated from other people are the islands, I suppose, that I anticipate will do best. Are there opportunities for diversification? I think yes, but I don't want to suggest that tourism is not going to be, going forward, relevant or important, because I think it will continue to be important. But we have already looked at agriculture. I have in the past looked at some of the statistics. Agricultural production in Nevis is beyond where it has ever been in our history. I think that has been a direct response to the stimulus that we offered at the Nevis Island Administration level, because our stimulus was geared to greater food security. The government said that we were concerned that our food security was dependent on tropical coming in from Miami and the Dominica boat coming from Dominica. And so we wanted to see how much food substitution we could do by encouraging our local farmers. That is why we gave free plowing, free land preparation, free fencing wire for farmers. We provided free fertilizer. We provided free water for 6 months to farmers, free seeds, free seedlings. And we have seen farmers respond. And we did that not only for established farmers, we did it as well for what is called a backyard farmer. So a lot of people are now producing food, even in their backyards. And we're seeing now these farmers, I don't know what to call them, kiosks, popping up all around the island as people are selling their produce. And we continue, of course, from this rostrum and elsewhere to encourage people to eat local, to buy local, and to support our local farmers. The quality is better, it's healthier, and of course, when we support our farmers, we support our own local economy. I think that those are the questions. I hope that I've...
How do you sell the borders opening to those who are skeptical?
How do you sell to those who are skeptical? It's a difficult question. I'm not sure how you sell it, except to say that we are all in this together. And in my own experience, most of the skeptics are people whose incomes have not been impacted. So if you're working in government, if you're working in some institution, you have not been laid off, your income has not been impacted, then you can afford to be skeptical, or you can afford to be more skeptical than the guy who doesn't know how he's going to pay to have his children go to school. I think that what we need to do is to sometimes walk a mile in the other person's shoes and understand. And if we have confidence in our health workers and the guidance that they've provided thus far, and I believe that their guidance has resulted in the phenomenal outturns that we've had. It's been difficult. I'm sure, LeSean, you said your name was? That you weren't happy being locked down. Can't go out, you can't go and have a drink, you can't, bars locked down, even church and all those locked down. I don't think that anybody was happy about those things, but we made some difficult choices on the advice of our health authorities. And so when we see now that we've now had, 19 cases, is it? No deaths, no hospitalizations. That's a phenomenal record. Each day, even from our region, you hear reports of new cases and deaths and things of that nature. Thus far, through the grace of God and the hard work and the hard decisions. Because it wasn't easy for government to try and restrict people. And it wasn't easy for people to adhere to those restrictions. Because we are free people. We are accustomed to do what we want. But all of us, together, and this is the same thing I think going to happen on the border reopening. All of us must be in it together. You can't say because things good in my house, because 3 people in my house working for government, so we're safe. What about your neighbor, where 3 people there work in the hotel industry, and none of them have an income for the last 6 months? We have to consider everybody, because we're all in this together. So once we can put the protocols in place, I think we need to get the borders open as quickly as possible.
Pleasant good morning to everyone.
Good morning.
I am Bjorn Hanley of BHC Media. For more details, please visit us at www.bhcmediaskn.com. Question number 1 What is the government's plan to safeguard citizens from COVID-19 when the borders reopen? Question number 2, will the government be extending its stimulus package to facilitate persons who are still unemployed as a result of COVID-19 pandemic? Question number 3, some businesses in St. Kitts and Nevis have closed or plan to close, leaving even more Nevisians unemployed. Is there a plan by the government to stimulate economic activity within the private sector? If so, what are the highlights of that plan? Thank you.
Okay, thank you very much, Mr. Hanley, for your questions, all excellent questions. Plan to safeguard when we open borders. In fact, I've been talking about that all morning. The training that we're doing with our frontline workers, the collaboration between Ministry of Health, the Tourism Authority, the Ministry of Tourism. We have already trained, as I said, close to 1,500 people who are on the front line, taxi men, immigration, people working in restaurants, customs officers, etc. We have come back now, 298 people trained, and these are trained to be trainers so they can go back to their establishments, their businesses. It could be a little mom and pop shop, but we are training people so that they could continue the exercise of ensuring that we are up to speed based on the protocols that we have and what we've been told. And I highlighted in my earlier presentation some of the areas that we have trained people in: how to put on the PPE, how to wash hands properly, how to even mix the right mix of disinfectant and sanitizer to ensure that we have the area sanitized properly. In education, I've outlined all that we have done at our schools, the fact that the buses now are bus attendants, etc. So we are not just doing things for the border reopening. We have been doing a number of things since March to ensure that our people are safe and that the environment in which we operate is as safe as we can manage it. But we recognize, as these 2 recent cases, somebody had asked me, I think it was about a week ago, and I said I felt so proud that for 5.5 months, Nevis has not had a positive case, even though we've continued to test. And then that dreaded call came from Dr. Nisbet. We have 2 new cases. And it shows us that this is the nature of things. 5.5 months of good results, which is probably a record in the region, obliterated on one day. We have 2 new cases because we have to appreciate that people are moving. And once people are moving, COVID, they're telling us, requires people. That's the vehicle. So either you're going to lock everybody down again and lock them down indefinitely and say, well, Mr. Hanley, you can't move out of your house or out of your household, and you can't mix and commingle with your neighbors or anybody else, and therefore we restrict COVID. And even then, I'm not sure that that will work. So we have been preparing ourselves and our people now for the past 6 months. What we're hoping to do now with the reopening is why we ramped up training now of those people who are going to be directly involved in the hotel industry, in the airport and taxi business. Those are the people that we are now targeting to ensure that they're trained and they're up to speed. What are we doing to safeguard people? I've talked about our distribution of masks, the only government that has done so to date. Making masks available to our churches so that when you go to worship, if you forgot your mask, you can be provided one. Making them now available to our schools. We made hand sanitizer available to all our churches on Nevis. These are some steps that we have taken within the limited resources that we have to say to our people, we're sending a clear message that it is our objective to keep you safe. So I believe that the effort thus far is commendable. We have been responsible. We have acted on the best advice that we have obtained from our health professionals, and we've been guided every step of the way by the COVID-19 task force, both the national task force on St. Kitts and the local task force that we put together here in Nevis, headed by Dr. Nisbet. The extension of the stimulus, I wish I could stay here and tell you, Mr. Hanley, that we will extend it indefinitely. I wish I could tell you and the public that we will continue to do as much as we can. But I want you to juxtapose the question and put it in the context of what I said earlier, that government revenues are at an all-time low. Without revenue, without any improvement in the revenue stream, your ability to grant further stimulus is severely impacted. I am pleased that we have done segue into your next question about stimulation of businesses, private sector. Yes, businesses are closing down. I appreciate that. Some that have closed, we are hopeful will reopen, like those in the hotel sector, for example. But we have not stood still. We have provided a raft of incentives for construction, saying that young homeowners, new homeowners, people who want to do renovations, people who want to do expansion, the government has put together a very, very robust concession package to encourage that. I am told thus far that there's been good response to that. And at another occasion, I can perhaps bring some statistics, because we said that that concession we would give until the end of December, so that persons starting construction between the announcement and the end of December would benefit. We have continued to ask individuals to take advantage of the small loans initiative at CEDU of up to $100,000 to try to inject again seed money for new businesses, new startups. And whilst we have had some business closures, I believe it to be true that we've also had some new businesses opening their doors, even in this difficult period of time. We see new restaurants popping up. We see new initiatives. A lot of local people are doing some very interesting and innovative new things. And I think that that too has to be encouraged. So the extension of the stimulus is difficult for me to tell you that this is what we're going to do. We're going to continue to give this for free and that for free, because remember, whilst it's free to the consumer, it costs the taxpayers ultimately, and we have to find the resources to fund it. And so that has been a perennial problem. And so we have been able to get the Social Security extension for 1 month for September. For that we are grateful, and I'm sure those who have received are also grateful as they are back to school expenses. But that is where we are. And so I think the answer now lies in continued encouragement of the private sector, the government trying to hold the line as much as we can in terms of what we are doing. And of course, we have to encourage border reopening is a critical piece of this puzzle as we try to understand where we move forward. I hope I'd have answered the questions that you asked, and certainly if you have others, I would take them. Yes.
Good morning, Devon Cornelius, Winifem. My question for you, Mr. Premier. What is the latest on negotiation on revenue sharing between the NIA and the federal government? Is revenue from the CBI programs like CDF being placed in the consolidated fund? Also, would you be able to give any takeaway from the 5-in-1 Fed that took place last week, in the context of containing COVID-19? Also, as a member of the federal cabinet and as Premier of Nevis, could you give any update as to when the borders would be reopened? And my last question for you is, as Premier of Nevis again and as Minister of Finance, what are some of the plans you have in place to revive the economy, especially with us being heavily dependent on tourism? Do you have an economic recovery plan for Nevis? Thank you.
Thank you very much. So let me start where you left off. I think we've been talking all morning about initiatives that we are seeking to do to generate economic activity. Maybe I haven't called it an economic recovery plan, but certainly I've been outlining initiatives that we have been taking, initiatives in the terms of the real estate sector, where we have waived our alien and holding license fee for the next 3 months, hoping to generate sales. Again, the construction sector, which we try to stimulate. Again, the small business sector, where we're providing loans at 4% up to $100,000. We have continued to talk about these various initiatives that we are taking and continue to take. So perhaps I've not used the language of an economic recovery plan, but certainly these are some of the initiatives that have been announced and to which people have been responding. We continue to urge people to respond. The last numbers I saw, for example, from the CEDU Entrepreneurship Fund that we're calling it, where we had $5 million available, I think the uptake was only about $550,000 to date. So it means that there are individuals out there who are still not taking advantage of the opportunity, even though we keep talking about the opportunity that exists. Update on the opening of borders. If I had a date, Mr. Cornelius, I would certainly give it to you. I do not have a date. These are matters that are being discussed at the federal level. and the Prime Minister in due course will no doubt announce. He has said that he's committed to an October date for reopening, but of course that has to do a lot with the training that has to happen, the readiness. I'm told that both airports, RLB and Van Zambri, will have to make some changes. For example, physical changes to the airport, how the flow of people is handled, how baggage is handled. All of these are issues that need to be resolved. So I do not have a date. All I have is the Prime Minister's commitment to the nation that the borders will reopen in October. 5-in-1 FET, you asked me for a takeaway. I wasn't there, so I can't tell you much about what the takeaway is. I have seen some photographs, and you said in the context of COVID. The question about FETs and parties and in this COVID environment is a difficult one. It's a difficult one. We have had some very robust discussions about this at the federal level and at the local level here on Nevis as well. At the risk of people being upset with me, if I had my way, I wouldn't allow any FETs at all. I just feel that if you have asked people to lock down in their home and you're telling churches that they must social distance even in church where you're going to praise the Lord, that the wine and walk up could wait. That is my personal view. However, we live in a democracy and we understand that different views have to contend. And the other side of that view is certainly the fact that there are a lot of young promoters out there who make a living by putting on these types of functions. And so do you lock them down as you've locked down everybody else, because they make the same argument that I was making earlier and tell you that they have their children to send to school, so how are they supposed to eat? So I think that the task force was in the unenviable position of trying to come up with a middle ground. And my understanding is that meeting with the police, the task force that is at the national level, met with the police and they came up with a set of protocols for these FETs. And it was on that basis that parties or FETs or whatever you call them will be approved, subject to these protocols. Those protocols have a lot to do with the capacity in terms of the venue and trying to ensure that they do not give, if the capacity is 3,000 people, you may get 1,000 being allowed in, that people have to be ticketed, that you have to have a note of all who's in the FET. So if you're going to the FET, you have to put your name down, etc., which will hopefully assist us in contact tracing if necessary. And these are the types of things, hand sanitizer, etc., that they have mandated. Now, I think that what has caused a lot of consternation is the picture that has been circulated globally, as people have called me as far from the UK with this photo and say, what's going on? I can't answer at the end of the day for people's behavior. I believe that each of us has a personal responsibility to try and keep ourselves safe. And so if some of us decide that we want to go and jump off a cliff, as much as you put signs and say, warning, jumping off the cliff is dangerous to your health, you may die, and you choose to jump off the cliff, then people come then to the premier and say, why people jump off the cliff? Each of us has a personal responsibility. And so I feel that when these events are allowed, that people must understand that they nevertheless have a personal responsibility in relation to how they conduct themselves at these particular events. Saying all that, I believe that the reports and the photos that surfaced, not only of 5-in-1, because there was something called Tropics in St. Kitts, there was Park and Walk Up in St. Kitts, there was a lot of events happening. Somehow there's been a focus on the 5-in-1, but the truth is that FETs have been happening and being allowed. And so the question, the issue for me that really comes out of it is that you can also see that there's a, I don't know what the right word is, Mr. Cornelius. I don't want to say a frustration, but there's a pent-up demand. People are anxious, having been locked down and locked up and restricted. People want to go out and they want to feel a sense of normalcy. People want to jam, they want to go in the band, they want to enjoy themselves, particularly young people. And so in a way you have to accept that there is some element of human nature at work here as well. So I'm not going to condemn the organizers. I think that the organizers could only have had this event with the sanction of the authorities and with the protocols that have been developed by the National Task Force working with the security forces. What I will do is I will urge those who get permission to host these types of events to put all the protocols in place, and I would most of all urge our people to continue to be responsible in all that they do. And part of being responsible might be that you take a decision and you're not going to attend. That might be part of you being responsible. But if you choose to attend, then you act in a responsible way. So that's as best as I could tell you insofar as 5-in-1 is concerned. Revenue sharing, that has, as you know, been an issue between the government of St. Kitts and Nevis at the federal level and the government of Nevis for long before my time. I believe it's an issue that went back to 1882, if memory serves, when these islands were put together. So it's an issue that is there. I have said that the unity government has, in my view, been the first government to attempt to do something about it. But more work needs to be done. And I think everybody accepts that more work needs to be done. And I believe that that work will be done, because certainly so long as I am there, I'm going to continue to agitate that we need to get an equitable arrangement in relation to revenue sharing. It has to happen if this country is going to function and if this country is going to flourish. It has to happen, that there has to be an equitable share of resources being allocated to the two islands that constitute this beautiful country of ours. The Constitution speaks an 80-20 split. That has never been applied. So in a way, we are existing in an unconstitutional manner insofar as revenue sharing is concerned. And so the urgency of dealing with it, some people see it as just a political issue. No, it is also a legal and constitutional issue between St. Kitts and Nevis. So I think that the issues need to be resolved. I believe that our Prime Minister, the Honorable Dr. Timothy Harris, is perhaps best suited to resolve it. You know why? His father is from Cotton Ground, and his mother is from St. Kitts. So he, better than me, could straddle one foot in Cotton Ground and the other foot in Tabernacle, I believe it is. He, better than most, I think, should understand, because he has the DNA of Nevis and the DNA of St. Kitts flowing through his veins. He, more than most, should understand the need to come to an effective resolution of this issue. And I commit to working with him and as part of the Unity Administration to get us to that promised land. That was the promise of unity, and that is a promise that I believe has not yet been realized. But like Moses of old, who led the Israelites out of Egypt, Pastor Wakely, am I correct? And Joshua, who took over and led them to the promised land. I think this is something that we must look forward to, and it is certainly a day that I would welcome when we finally get these matters resolved, so that the people of Nevis and the people of St. Kitts are clear as to what is their share of whatever comes in to the nation of St. Kitts and Nevis.
Good day, Mr. Premier. Elke Hewlett, Department of Information. I'm hoping that my questions will be a little less controversial than 5-in-1 and the split of the CBI monies.
Didn't realize those were particularly controversial, Ms. Hewlett, but go ahead.
In relation to the salary cuts for the members of the NIA cabinet and yourself foregoing your salary, I think that was in April. Can you give us an update on that? Because I know the salary cut itself was supposed to have been for 3 months. And also the nurses were promised a little bit of a salary adjustment in the upward direction. And has that matter been resolved?
Okay, let me deal with what I think is the more important of the two questions, that is the nurses. Frontline workers work hard, long hours, deserving of every penny that they earn. Not generally people who are highly paid, and I pay homage and salute them. We have promised an increase to our nurses. I asked, because I anticipated that this question would come, for an update this morning. All that needed to be done on our part has been done. The only thing that now needs to happen is that the Public Service Commission has to sign off on it. The Public Service Commission meets once per month. And it is a very involved process, because there are different scales, different nurses, nurse attendants, that kind of thing, and they're on different scales. Some people are within the scale at different points within the scale. So it's not like you could say, okay, staff nurse, all of them going to get an extra $500, because some of them are in a different position in the scale. So let's just, for example, assume that the staff nurse scale is N30 to N36. You may have some at 32, some at 34, some at 36, depending on the years of service and qualifications. So the Public Service Commission has said that we had to really, almost on a case-by-case basis, do that analysis. I'm told by the Human Resources and the Permanent Secretary, Mr. Edson Elliott, who's been working hard to put this all together, that all that work is now done and that it goes to the Public Service Commission this month at their meeting. Once that is done, the pay will be retroactive to the 1st of June. So the nurses are not going to lose out. They are being assured that the increases are going to be retroactive to June 1st. And that was what we committed to, and that is what we will honor. And so we hope that by next month we should have this all sorted, and the nurses would be the beneficiaries of this long-promised increase for them. Salary cuts, we did promise the ministers took a 10% salary cut for 3 months. I do not know, but I would assume that because those 3 months are over, because this was April, May, and June, that their salaries would have resumed. For my part, my foregoing of my salary has continued to date. So I have now gone, I think, March, April, May, June, July, August, September. This is my 7th month of foregoing whatever salary obligations and commitments. And again, I think when one is in a leadership position, one has to try to demonstrate that in difficult times we understand. At least we try to understand what people are dealing with. And I thought that it was a gesture that we came up with here in the cabinet room, and that we thought would indicate and send the right message to our people that we understand what they're dealing with, and we're trying to, in that very small symbolic way, show that we understand and that we are part of that struggle with them. So my own salary commitments have been foregone and continue to be foregone. I did say until the end of this pandemic, I don't know whether this pandemic is going to end, so I have no idea when, again, I will be able to collect a salary. But at this point, I continue to forward that salary, and God continues to be good to all of us. So we hope that soon we'll be able to resume some sense of normalcy. Are there any other questions?
Mr. Premier, one last question. You said 2 things earlier which I found were profound as it relates to Mr. Cornelius's question, as it relates to FETs and that sort of thing. You mentioned that, of course, that each individual should be responsible, and that a person who holds these events, the entertainment agencies or whatever, they have families to feed as well. Mm-hmm. But from a practical standpoint, sir, let's say they put on an event called 6-in-1, just an example, and they meet whatever requirements or protocols as it relates to social distancing, etc. Now, they say these things are going to be enforced, but from a practical standpoint, you find that if people are gyrating, so to speak, they're not wearing any masks, they're enjoying themselves, they have their rum in the cup, so to speak, they're not social distancing. What would you say to that, sir?
What would I say to what?
From a practical standpoint, like, what is it that you would say to these kind of things? Like, they meet the requirements, of course. Now, they say they're going to put these things in place, but you find, just given a scenario, that these things are not happening.
But if they're not happening, I think that it becomes an enforcement issue. And it goes back to the question, I think it was you asked the question earlier, if people don't go through the training and decide they're going to open up anyway and function in any old way, and my response was that they will be inspected and, if necessary, shut down. So I think it goes back to an enforcement issue. Now, if this task force and the police jointly have said, we have heard the cries of the promoters, we understand that they have their families to feed, we also understand that the country is crying out for some entertainment, people are parched, people have been locked down, people want to free up themselves, we understand all that. So we've sat and we've come up with a set of protocols. Now, if your FIT is allowed to happen and you're told these are the requirements and you breach those requirements, then to my mind the response is to shut you down and the necessary fines, because I think under the relevant regulations, you can be fined as much as $5,000. So that to me is what has to happen. So your question to my mind has more to do with enforcement of the protocols, as opposed to whether or not you allow the FET to happen in the first place. As I said, I indicated what my personal view was at the start, but I recognize that there were other views, and ultimately that those other views prevailed, and I respect that. And certainly, I had no criticisms of 5-in-1 or of Tropics or of Park and Walk Up or whatever they're called, because these are events that I understand got permission, and I have every confidence in our task force that they are sensible people, rational people, because they have guided us well thus far. Let's give them at least some credit that they have guided us well thus far. What I think is the unfortunate thing is there's, as usual, the misinformation, because some people I've seen have taken a photo and sent it around. A lady contacted me today from the UK, and she said to me, how could you allow this? Because as a result of this, we now have 2 new cases in Nevis. When the people who got that case, those 2 cases, I don't believe they've been to a FET in the last 50 years. So they had nothing to do with one another, but you understand that in this environment that people are saying things and making sometimes things more than they are. So we hope for the best. I saw people went out, they claimed to have enjoyed themselves. I am hopeful that the restrictions that we have in place, the fact that we have been COVID-free for the last 5.5 months on the island, and that the cases that we have recorded are imported cases, people who've flown in and went directly into quarantine and then isolation, that I don't anticipate that we should have any spike or any new cases as a result of the FETs. And that, I think, is what the task force was looking at in terms of making a determination and coming to a decision. I also feel that we will see an ongoing relaxation. You remember there was a point we were locked down? People were going grocery once a week. You're going by zone, depending on which part of the island you're from. That now is almost a distant memory for many of us. Because you waltz into the grocery now, you pick up what you want, and you're back to normal, except now you must sanitize and wear the mask. And I think that we have been gradually relaxing. There's no further curfew. Which thing? So I think as we go and as we learn, you will see a gradual relaxation once, of course, we don't have any spikes and once we don't have any community spread. So I'm optimistic that we're on the right track, and I don't think that we should be distracted and start to be overly critical, because we have not yet been failed by those who are advising us, and they've advised us well thus far.
Thank you, sir.
Welcome. Are there any other questions? Mr. Hanley?
2 final questions. Mr. Brantley, the COVID-19 task force has said that when the borders reopen, that travelers coming to St. Kitts and Nevis will be quarantined at a government facility for 14 days. My question to you is, how many tourists do you think will visit Nevis knowing that they have to be quarantined at a government facility for 14 days before they could actually start their vacation, considering the average vacation is 5 to 10 days of a tourist? Final question, Mr. Premier, now that you have all 3 seats, what is stopping you from implementing the Charlestown Accord in full? Thank you.
If I start where you left off, the Charlestown Accord was a political construct which formed the underpinnings for the Team Unity government that eventually arose. It was signed, if I recall, by the Honorable Vance Amory, then leader of CCM, the Honorable Sean Richards, the leader of PAM, and the Honorable Timothy Harris, the then leader of PLP and continues to be leader of PLP. It set out, I think, what the aspirations were of Team Unity. Some aspects of it, I think, have been complied with. For example, the representation on boards and the fact that we now have Nevisian ambassadors and things of that nature, which never happened prior to 2015. Other aspects have not quite been finalized in their rigor, and I think it takes us back to the question that was asked earlier about revenue sharing, because that was a critical part, CBI proceeds and revenue sharing of the Charlestown Accord. It, however, goes beyond the Charleston Accord because, as I've said, this is also a constitutional issue because the Constitution not only says what the share should be, the Constitution says what mechanisms can be employed if that is breached. So there is constitutional redress that is available. And that is why I'm saying that this is a matter that continues to agitate our minds and continues to be a product of discussion. And I feel an important issue that has to be resolved soon so that these questions will no longer come and that you will know exactly what the share is and what the arrangement is. So I feel that that is the situation as it currently exists. Insofar as us having 3 seats, absolutely, the people of Nevis saw and gave us their fullest confidence to move forward and move the island forward. And we are going to continue in that vein, engaging with our people and engaging with the representation that they voted for, and that is to give the Concerned Citizens Movement all the available seats at the federal level. We would hope that in short order, when we go back to the polls, we will have all the seats at the local level as well. So, because I think people are clearly looking and doing that assessment and analyzing and determining what is best for Nevis. And I have fullest confidence in the people of Nevis to make those decisions for themselves. They have not proven me wrong yet. Insofar as the COVID-19 task force, you said that it is said that tourists would have to quarantine for 14 days in a government facility once the borders reopen. I do not believe that is correct. I think they did have a discussion about quarantining for 14 days, but the idea was at your hotel or at your villa, not at a government facility. Because even now, all the quarantine is not at government facilities. In St. Kitts, you have OTI, which is a government-controlled facility. In Nevis, we have a government facility at Potworks, and we have Wally Hotel, which is offering a section of the hotel, if you're willing to pay, to stay there as well as your quarantine facility. We expect to see more of that. And some of the smaller hotels have already applied and said, well, you know, I have 14 rooms. Can I be a quarantine facility for those people who may want to come and be in a bubble? That's a fashionable language now. They want to be in a bubble in the hotel. Can they come and do that? The question, I believe, of whether people will come if they have to quarantine for 14 days, say, even at the hotel. So if you're coming with your family and you want to stay at the Four Seasons and you have to stay within the resort and within your room or confines in the resort for 14 days, that is something that is being hotly debated at this point in time. The hotel sector has a very clear view, which is saying that the average stay in Nevis is 5 to 9 days. So a 14-day quarantine just is impractical, doesn't make sense. Again, these are conversations that are ongoing, and I think that these various ideas will have to be refined as we get closer to an opening date so that people are clear as to what the protocols are. We have also had some additional movement, which I'm sure you would have heard, and that is to allow people now to quarantine in their villa at their own home. That is now also happening, and we're trying to work out the protocols for that. Because when we tried it at the start of this pandemic, the problem we had was that people were not adhering to the stay at home and the quarantine. Incidentally, I saw a funny thing in the U.S., thankfully not here, but in the U.S., where a university student, the police came and he had over 20 people at his house having a party. And the policeman said to him, but my system is showing that you tested positive for COVID a week ago. The guy said, yeah, I haven't left my house. But I invited friends over. So as far as he was concerned, quarantine for him meant that he's not leaving his house. So we have to get our people to understand what is involved here, and that if you're in quarantine, you're in quarantine. It means you're not leaving, and it also means nobody coming to visit you. You're in quarantine, right? But we have moved now to say that people can do it at their homes. So a lot of homeowners at Four Seasons, a lot of local people who have been away, who have their homes, they're now opting to come back. One of the discussion points has been the cost, because security is now required, and 24-hour security is going to be required. So the security firms are being trained by the police to ensure that they know what to do, and the security firms will charge these homeowners who want to quarantine at their personal home. What normally will happen, we call it a pre-approved program. The task force will come, they will inspect your home, make sure that the home is okay, meaning that you have the room separate, bathroom separate, etc. And then once it's pre-approved, you will have to contract with the security firm and get that security firm to provide the necessary coverage. We say 14 days, but it could be 15, it could be 16, because we recognize that you then have to test at the end, and we wait for the test results and things. So there's a cost associated with it, regrettably at this point, but we are hopeful that as we move forward, these things are going to be refined and continually refined. As I've said, personally, I like the model that I've seen at work in St. Lucia. It's a model that is getting good attention, positive attention globally. In fact, the CDC, the Centers for Disease Control, has put St. Lucia in the top 8 in the world in terms of how they're dealing with this. So I think it's something that we can certainly look at in terms of guidance going forward. But no manual, no template. So in a way, everybody is forced to adjust and adapt as we move forward. Any other questions? No? Okay. Ladies and gentlemen, thank you very much. Thank you for your attendance, and certainly we look forward on the next occasion to seeing you here and to having this engagement with you as we continue in our effort to have a more open and more transparent government. Thank you, and God bless you.